Hi, so my name is Jordan and I'll be talking about Charles Bonnet syndrome. CBS affects those who are visually impaired. They don't have any neurological or psychological abnormalities, and usually the damage is to their eye or brain. Detailed radiology examinations like single photon emission computed tomography or SPECT are used in detecting an asymmetrical perfusion in the temporal lobe, the parieto-occipital region, and the brainstem. We are introduced to James Thurber in Chapter 5 of Ramachandran's book. He lost his vision in his right eye when he was a child due to it being pierced by a toy arrow. As he got older, he started to experience hallucinations. He claims that he saw an older lady walk through the side of a truck and bridges lifting into the air like balloons. These are just a couple of the many hallucinations that he saw. In another case, an 82-year-old woman with a history of blindness in her right eye due to cataract surgery was admitted to the neurological department as a result of her hallucinations. She stated that for the past 2 months she had been seeing different people from her dreams who seemed more real when she was awake. And it is interesting to note here that people with CBS who hallucinate faces and such, usually the faces of people are unfamiliar. And on the way to the hospital, she also said that she saw vividly dressed children and a castle with high towers. CBS is extremely common. Results from studies vary. Some claim it occurs to 10 to 40% of patients with visual impairments, and others indicate it affects 40 to 60%. However, it does affect millions of people worldwide. After some initial confusion, about 80% of patients with CBS usually know the hallucinations are not real. Those who initially believe that they're real will eventually realize that they're not. The two forms that visual hallucinations usually take are simple or complex. Simple hallucinations can be anything from flashes of light to shapes, and the complex ones are well-formed images, like faces or animals. Those who experience the complex hallucinations are usually those with a creative personality. In about 72% of cases, the hallucinations in CBS are in color, and they are also reported to be more vivid and bright than anything the patients have previously seen. Management includes treatment of the actual ocular disease. It is expected that the likelihood of CBS will increase as 53 million people will be older than 65 by the year 2020, increasing glaucoma and age-related macular degeneration.